My name is Zavala. Full name is Baltazar. I'm a graduate student here at the NIH. So I work with patients who have Parkinson's disease and who are getting deep brain stimulation. And if you don't know what deep brain stimulation is, I would highly suggest that you look it up on YouTube, because it's the coolest thing you'll ever see. It's patients who have very, very severe Parkinson's symptoms like tremor. And what it is a surgery where they stimulate their brain, and you can see it becomes essentially like an on and off switch for their tremor. Once they're in the operating room, we're recording the activity from deep inside their brain where they're going to put the deep brain stimulator. And we're trying to understand what the stimulator is actually doing and what that part of the brain is supposed to be doing. So we'll have them play very simple computer games where they make decisions or try to understand what is going on the computer at the same time that we're recording from their brain, which I think is very fascinating. And it's how we're trying to understand ways of improving DBS and understanding how it actually works. So my mom and I moved here to the US from Mexico when I was 4, and we moved to El Paso, Texas, which is where I grew up. And after graduating from high school, I went to Harvard. There I majored in engineering. And when I was a senior and I was trying to decide, what should I do? Should I go to medical school? Should I do a PhD? Ultimately, I decided I really liked research and I wanted to do a PhD. So I started looking at different programs, and the NIH had this great program here where they allowed me to work here for 2 years, and also they sent me to Oxford in England to work for 2 years. And in both places I was able to do some really cool research, and now I'm doing the second half of that entire project here at the NIH. I love the community that's here at the NIH. It's nice to have just one place where there's thousands of people that you get to see going through the same excitement and the same frustrations that you go to. It's nice sitting in a conference room and hearing the person next door talk about the hardships they're dealing in the lab, and then you realize that, okay, I'm not the only one. It's hard for everyone, and when you see them excited, it gets you excited about your own work. And I think there's just a lot of bouncing off of each other that happens in the NIH. And I think that's probably my favorite thing about working here. So there are 2 types of typical days here in the lab, and the first type of day, which is the one I'm most excited about, that's when we actually get to test the patients. So on those days, I meet with the patient beforehand, we run through the tasks that we're going to do, and then I get to actually go in the operating room and watch my boss, who's the surgeon, operate on the patient, and you get to see the patient responding to the stimulation for the first time, which is amazing. And then we get to actually run different tests with them, different experiments where they move around and respond to what's on the computer. And then I finish up and take the data home. That's the majority of my time is spent actually analyzing that data. We record gigabytes and gigabytes of data, and we spend weeks just processing it, analyzing it, and that's the really fun part, because that's when you're giving a very noisy signal, kind of like what you see here. And your challenge is to take that noisy signal and try to understand what the brain is doing. Right now we're in a really, really cool part of the project, because we finally have experiments that have worked, and we're making progress in understanding how the brain processes, in this particular case, conflict. Right? So when you're making an easy decision versus when you're making a much harder decision, somewhere in your brain something's doing something differently that lets you make that decision. And we've found some really, really cool findings that show that different parts of the brain are actually talking to each other during conflict. And they're using very specific frequencies of communication, kind of like a radio conveys information at a very specific frequency. That's what the brain is doing, and we're finding that, and that's opening up a lot of really cool doors for where to go forward. The first time where I really found science kind of to be something that was something that I wanted to do for a very long time was in high school. It was in my first physics class, and before that, science had always been interesting, but nothing that I found myself in love with. My high school physics teacher, he was also my high school basketball coach, Coach Chipra Scala, he had this really, really fun way of teaching physics that really drew me in. I mean, he would take things that we encounter in our everyday life, such as a microwave or a mirage that we'd see in the street, and he would tell us what's causing them. It blew my mind and inspired me to continue to learn more. And it was learning how these things worked that really motivated me to try to understand more and more and learn as much as I could about what we already knew, how things work. And then eventually you get to the point, when you're in college, where you realize, I can actually discover how things work too. And so I started working in a laboratory. I loved it, and that's how I decided to eventually do my PhD and go down a science career. I would say, if you're early on, you're still young and you love science, try to get as much exposure to science as you can. Go to your local university, find someone who's doing something that's interesting and just ask them, can I follow you around for a day, for a month? I mean, that might even turn into a summer job if you do it long enough. And I think it'll inspire you to continue to grow in your passion for science and continue to explore. It'd be hard for me to imagine me not being a scientist, really. I mean, I'm doing what I love right now. I think going forward, I'm going to go to medical school so I can see patients as well. So I think if I wasn't doing just science, I'd probably be doing only medicine, clinical medicine. And my goal is hopefully to do both, because I really like working with the patients right now, but I also would like the ability to treat them as well as experiment with them. We do science together currently. I'd also like the ability to help them in some way. So that's why I'm going to medical school after this, so I can do both.